And I think you did very well for the first time.
Thank you. Thank you very much. I was a little nervous.
Wow, that's only normal to be nervous. But
I just experience.
you have the patient comfortable, and that was important. And there you are. Mark, you and Melissa continue with your patients while I work with Katie, and I'll catch up with you later.
That sounds great.
Okay.
Thanks a lot, Miss Scott.
Bye.
See you later. Bye, Katie.
See ya.
Well, Katie, you ready for me to see your patients with you?
As ready as I'll ever be. What are we going to be focusing on today?
Well, I thought we'll start with axillary temperatures, even though it's the least reliable of all the sites. But sometimes we have to use a patient's axilla to get a temperature reading.
When would you measure an axillary temperature?
For the most part, you measure an axillary temp when the oral, rectal, and tympanic readings aren't possible. And in this case, your patient is on a number of IV medications that are making her throat and mouth sore and inflamed with ulcers.
So an oral temperature reading is just out of the question.
Right. And a tympanic thermometer might increase the pain she's been experiencing from her stomatitis.
What about a rectal temperature reading?
Well, normally that would be okay. But her white blood cell count has dropped to a dangerous level. So an axillary reading is the best choice.
Okay. Hello, Mrs. Stevens.
Oh,
Hi.
hello.
I'm Katie Roth. I'm a nursing student, and this is my instructor, Miss Scott.
Mrs. Stevens, hi.
How you doing?
We're going to be taking your temperature today, if that be all right?
Yes.
Okay, great. I just need to take a look at your ID bracelet. Okay, thanks. I'll just pull the curtain a bit.
Miss Stevens, you look a little uncomfortable. Can I help you? Can I get you anything?
No, that's all right. Thank
Okay. All right.
Have you had your bath today, Mrs. Stevens?
you. Yes, I had it about an hour ago.
Good. It's very important that we wait about 15 to 30 minutes after a patient has had her armpit washed before taking an axillary temperature. Okay, so I'm just going to pull your gown back a bit here.
Okay, Katie. Now be sure you place a probe cover on the thermometer before you get your reading, okay?
Right.
Okay.
Okay, I'm just going to lift your arm up a bit.
Okay, good. Good
Great.
placement.
Okay, all done.
Okay.
Great. 99 degrees. Thank you.
Okay, 99 degrees, Miss Stevens. We hope you feel better. All right.
Thank you.
Now, Katie, I need for you to note the temperature and the site. Okay. And also remember, if you have any abnormal findings, you must report it to the patient's care provider.
Okay,
All right?
great. Thank you.
Thank you,
you.
Mrs. Stevens. Feel better.
Thank you.
Okay. Bye-bye.
Bye-bye.